Always interested in data. Thank you, Angie. Good to see. Thanks, y'all, for continuing to pop those in. I'll have it on my other screen to see that flowing through. Um, but so as just shared, I'm gonna give you an overview of kind of all the tools on the site. There's a lot more you can dive into, but I'll give you kind of an idea today of how best to navigate and understand some of the things, especially the data. I know a lot of y'all are writing grants, like she said, whether to Reid or to other organizations, and this data can be really useful to justify the work you're doing and better kind of guide where we want to go alongside that community narrative that we know you are very close to. So right now I'm on the homepage. You might have been here before. Hopefully you're probably familiar with this. Just want to give you like some general housekeeping and understanding of what the site is overall. So it is just in general a customizable web-based platform where we have a variety of tools for analytical insights into your community's health and just overall well-being status. So that includes obviously the data. It's a centralized hub for data that we maintain. So from Conduent HCI. Sorry, I didn't fully introduce myself, but I'm with Conduent Healthy Communities Institute. And we maintain the data, but also this platform, the product side of it, which includes also evidence-based best practices. We'll take a peek at those in a little bit, and a variety of different tools to communicate your story. We got someone. All right. Thanks for finding me.
Sorry.
No, you're fine. I know we're all in different places. And so we have those tools to communicate your story using that data, but also alongside the initiatives that you are probably already working on, and just to give it maybe a more of a data-based and evidence-based backbone when you're trying to justify usually funding, right? We have tools in which you can measure and really share that impact of your programs, and with different progress tracking tools and a variety of things we'll take a peek at today. This also, as you probably know, is a repository for, take a peek down, those different grant application and reporting tools, but also the community health needs assessment and implementation plan. So those can always be good for a guide of what kind of things we maybe want to commonly work on. And then just in general, one last thing from the homepage. Like most websites, if you click up here, this banner will always stay with us. If you click on it, it takes us back to the homepage. So that will be on every page. You can always click there to go back there. So for today's tour, we're going to start basically in the navigation bar, kind of starting right or starting left and going right. So I'll start over here in the community dashboard, that very first option in the drop-down menu. I will share these links in the chat as we go too. So if you want to follow along, poke around, feel free. But let's take a hop over. I have it already open, but feel free to take a peek here as well under Explore Data, Community Dashboard. And so this is in the chat now, and this is your dashboard's landing page, I like to call this. So this is where we have some curated dashboards you can see around these different topics that are pulled together, these specifically related to the community health needs assessment and improvement plan. So focusing on some key topics that we are interested in addressing in the community, but also a few that can give you a little bit bigger of a picture of what's going on. But if none of these are quite what you're looking for, so I know we had some folks related to, so we have shelters and maybe like housing, food insecurity, maybe something a little bit a hop outside of what these are showing you. We also have these different search features. So by keyword, that is just any word that could be related, but doesn't have to be specific to what the data are called, so what an indicator's name is. But then over here, we have the full list of all indicators. So quick pause, just so we're all on the same page of what an indicator actually means. In this drop-down menu, you can see titles of indicators, but overall, it's just a measurable population characteristic. So under health, alcohol and drug use, we can see adults who binge drink is that very first indicator listed here. These indicators can include things related to health. Obviously, that's a big focus we have, but they can also describe an aspect of the population used to measure quality of life. So maybe education, childcare centers, maybe I know like food insecurity. We've got a lot in there, but even economy, or a few things. There we go. Employment. A lot of things that we know also affect how well folks are able to live. So you'll see there's a large variety as you scroll or as you start typing. When you type something in here, though, just for logistical understanding, the word that I start typing has to directly match something in this list. So say I start typing high blood pressure. Perfect. We have these couple of indicators here. If instead I started typing hypertension, those others wouldn't pop up. That's where the keyword search is better, a better tool if you're not 100% already sure of what you're looking for. If you do know, though, start typing in here. You can pull that specific one up. And then lastly, to get a little bit broader, a little more general of a view. So I know y'all work in communities, you know probably a lot of zip codes, definitely different counties. On this side, we can search by location. So we have y'all's several counties across Indiana and Ohio, the overall service area, but then we get a little bit deeper. You can see this thing will scroll for a long time. We can get deeper into census places, which are specifically towns or cities that are noted as census places. So you're not going to see everywhere in there. Then, like I said, we have zip codes and then census tracts, which I assume probably not many folks know census tracts. They're very long numbers. But we have this map selector to the side. If you want to get, that's the most granular data we have, so the smallest locales available. So especially when we get into like the more urban centers, we'll see those teeny tiny little sections, and you can see the census tract number hovering over there. I've only ever known like epidemiologists to really know those numbers, but more power to you if you do. But this can get you like very specifically into one of these areas to see what's going on and get a better idea of what the status of that community is. So if I click on any of these locales, whether it's county, service area, census tract, any of these, it'll pull up all of the data on the site that are available for that locale. So that will include things from health to education to community, economy. And so one thing to note is we don't have as much data at the census tract level. If you can imagine, things that are collected nationally a lot more often are available at the county level, and then it's really only a few sources that get down to the smaller levels. So we'll have a little bit more zip code that's more frequently collected. But I would say census tract and census place are a little more niche, so you won't have as long of a list for that one as you would for selecting a county. Okay, so that is our dashboards landing page. Any questions while we're here? We have more places to go, but give it a pause. All right, so that's how you can search for data if you want to see a specific location, specific indicator, or just what kind of data are available by keyword. We will in a second take a peek a little bit deeper to get more than one indicator at a time, make your own list, your own dashboard. But you can also search through these dashboards, which we'll take a peek at the demographics dashboard now, because I know y'all probably, if you haven't used that one, you might need to in the future for giving kind of that background on what your community looks like, what the baseline status of like who's who we're working with, who we see here. And then often we'll get a little bit deeper into like, and this is the issues or the places we want to fill in with your services. So if I click on demographics dashboard, that will take us here. This one also up top is linked under demographics, same thing. And I'm taking you to this one specifically, but this will give you an overall view of how to navigate really any dashboard. They're all set up similarly. Some of them have maybe slightly different appearance, but overall it's the same tool. So this is the same under all of these, the disparities dashboard, and then all of them that are within the community dashboard, the dashboard's landing page. Also the Healthy People 2030 progress tracker, some good comparisons nationally there. So this is a dashboard. Like I said, just a list of those indicators specifically pulled together, in this case, related to demographics. So we have a little spiel of what this is, where these are coming from. It's modeled after the Census Bureau Quick Facts Demographics Profile. All of these indicators are primarily coming from either the Census Bureau or the American Community Survey. If you have any source questions or like getting a little bit deeper, we will take a look a little closer into these in a second. But also please pop questions in the chat or come off mute. And I'll pop this in the chat as well. But so how a dashboard is organized, we'll just briefly go through this, get you an idea. Starts off up top with the overall topic. So these are population, right? Demographics, looking at how many people, who's what, where. And then the so topic, we would have a subtopic if it was like health, and then we saw alcohol and drug use as that subtopic before. Population just is what it is, so there's no subtopic here. And then this, because we have, you can see this really tiny scroll bar, we have all of our locales included here. So see all these counties, and it starts going all the census places. This is a very large dashboard. So we won't scroll too much, just wanted to see what all is included. This is the indicator name. So in this one, we have all of these down below are showing the total population for this locale. So for the county, we have that value over here, and then it'll tell you if it's not immediately clear. So like if it's not a percentage, it'll tell you what that the value units are. So people here, 51,462, and in 2024. So it tells you that it'll always default to the most recent period of measure, or that time for the data. But we also, once we get a little deeper, we can see previous year's data values. And then, so again, title, locale, if we have it organized in this way, at value, period of measure, then we come over to the comparisons. So this shows the prior value. So if we click into that, we can see what year that's for. Some of these, this is 2024, so these are most likely annual if it's that recent and it's for a single year. But we can always click into this to see if that's maybe 2022 instead of 2023 for some reason. But that's the prior value. And then this little arrow up means that it now is higher. We got 30 more people in Darke County. So that's very specifically 32. It's gone up over the past year. And then we can see overall, though, the trend. So this will show up once we have at least 4 periods of measure over time, and it gives you that direction of in which it's trending over time. So unfortunately, okay, we went up by 20 people, sorry, 30 people in that single year change, but overall we're headed down. So you'll see the differences here. This one has also gone up a little bit. This one's gone down. But then you see these trends. Some are shaded, some are not. You don't have to remember this, but just so you have an idea, and I'll show you where to find it. That means that it's a statistically significant change or not. So filled in means it's statistically significantly changing. So it is like a big leap happening, and that is continuous. But the trend down, not filled in. So you'll see some of these are filled in down here. It's not quite statistically significant yet of a change. So maybe we have those confidence intervals that are overlapping. So there's a possibility that this change is not fully represented by the data. But if you have further questions about the statistical significance and what we see there, we can talk about that on the side too. But these are all blue because these are population indicators. So they're in other dashboards, they might be red or green. I'll show you over here in our legend how we can kind of distinguish between what all that means. So this guy lives over on the side. I've selected it to pop out, but you can always hide it again. But blue just means that it's a neutral change. Like we aren't saying it's good or bad that Darke County has gone up. You might feel one way or the other, but in the scheme of like health, we're not saying that it is one way or the other. If it is like diabetes incidence or something that we know we don't want to see more of, that would be a red arrow as it's gone up since the last value. We also sometimes have these distributions. So these are specific count values. We're not going to have that necessarily that distribution across counties or other comparable communities. We have targets sometimes, so like the Healthy People 2030 targets you'll see attached to some select indicators. And then these are the two that we see here. So compared to a single value and then that trend over time. So this is not a significant, so not statistically significant. That's what we saw. These aren't filled in. And then this is a statistically significant change when it is filled in. If you get here, you open up the legend, but you're still having questions, you can always click more, and that'll take you to our Help Center. This will give you a little more context and then where you can see a little bit more of what you can do with it. I recommend if you're ever stuck, always look for more or our help button over here. So if I forget, what did you say an indicator meant? What was that? So if I type that in, this will give us, you can go to what is an indicator specifically. This will give us that article from the same place. So this is a help center that we maintain. We fully build out all of the content here. And so these examples are from actual sites that we use too. So, okay, so I'll put the legend away, put the help button away. The help button will always be with us. The legend will be with us if we are on a dashboard or an indicator detail page where we'll head soon. But this was a dashboard. So remember, it's organized usually by topic, maybe subtopic if we have it, and then those indicators down below, title, locale if we distinguish between those, value, defaulting to the most recent period of measure, and then all the comparisons that are available for that. Do we have any questions? Feeling okay? All right. So on our next stop, we're going to get a little bit deeper, a little more specific into the data, but then we'll take a hop back so you can see maybe more of what you're specifically interested in. So if I click on this, like I said, the whole time that will give us a lot more context specifically for that total population in Darke County, Ohio. But I have this one open for an indicator that gives us a little bit more comparisons. So actually, let's go ahead and go to Darke County though. Because this one is, as you can see, we have a lot more comparisons. We're going to have more locales and just some prettier things to see examples of too. So now this is the indicator detail page. Up top, like I said, this is the indicator that I selected. If I wanted to change that though, I could go ahead and start typing in population, change it to, there are a lot that have the word population in there, but I could change it to any of these and it'll update the entire page. You can see I just selected the county. I could change this locale and it'll update the whole page related to where I choose. The measurement period will always default to the most recent. So there we go. But I could update the whole page to any of these as well. And then those will stay with me. You can see up top as I scroll down. Just a note, we are having a product update in this month within the next couple of weeks, I believe, that will give this page a little bit of a facelift, an overhaul. The same content will be here, but it should be even a little bit more streamlined to navigate. So If you come back here and you're like, whoa, it's different, that's okay. What I tell you today will still help you navigate it, and you'll have a few more options even when that change comes. So just a side note there. I'm going to pop this in the chat though, if anyone's following along, if you want to poke around, see this indicator as we go. And so what we see next is the text. So this is just the definition, what this indicator shows, specifically percentage of families living below the federal poverty level. This is most often verbatim or very directly pulled from the source. So that's not something that we're adding to or really manipulating, other than just giving you that specific context, directly what it says from where the data are coming from. The source lives down here, and this has a link directly to that page. So the ACS, it's not necessarily to the page that this indicator data are on, because that changes often from them, but it'll take you to where you could dig a little deeper. If you ever have questions though, let me know, or let Jess or Katie know, and they'll pass it to me. But then before we keep going, why is this important section? So hello, grant writers, perk your ears up now. I love this section if you are writing anything, a report, a grant, but anything to give kind of that reason why we want to look at poverty in this instance. So these are pulled together. These are a little bit more of like a Frankenstein, not just one thing specifically pulled from one source. These are often pulled from like the Healthy People 2030 targets, or the Healthy People 2030 overall objectives, or national reputable sources that give a bit more of that outside context of why we want to focus on certain issues. So we can see what federal poverty thresholds really mean, like where those come from, and then what that can indicate if we have a high poverty rate, what that can lead to, like decreased buying power, how that can be associated with lower quality schools, decreased business survival, thinking about taxation to get schools funded, things like that. So that gives you a bigger context to relate it to other things that y'all might be looking at. If you ever have questions or like feedback or thoughts on any of these areas, let me know, because we have a work group that's updating this kind of content across the site, just to be sure that it's like the most relevant and helpful. But also anytime these indicators are updated, all this is reviewed too. So remember from up top, we had the indicator title, the county. So we see that coming down here with us, and the measurement period. So scroll too much. This left side gives us that kind of quick overview. Same information there, but a little bit deeper into what we're looking at. We have that value again here, 8.3%. Well, not again, but what we would have seen in the dashboard. But then now we have the measurement period, but also who maintains it. So if y'all happen to have any data that you give to, say, Jess or Katie, that they want to add to the site, so maybe programmatic data, maybe de-identified grouped hospitalization data, anything like that, it might say Reid Health here instead. But most of the ones you'll see will say Conduent HCI. Then last updated, so as I mentioned, all of this is reviewed each time that these indicators are updated. Most national sources, so this is a national source, doesn't say Indiana or Ohio XYZ source. Most of these are updated around the same time each year. So these were last updated earlier this year. We can look out for them to be updated again around that time next year. If you ever have questions about that, please let me know. And then these filters are just saying that Darke County is included in those two overarching locales as well. Now you can see we have a lot more comparisons here. We saw the trend before. Now that we're on the indicator detail page, if I hover over it, it tells me a little more about that. So over time, this value is decreasing, but not significantly. If you remember, it's not shaded in, so it's not significant in that change. And then the technical note tells you how we calculate that trend over time. So it's over multiple periods, at least 4 up to 10 man-Kindle tests for statistical significance. If you have questions, let me know. But then we also have those comparisons to specific values that hover. The tooltip that pops up, that little box, tells you a little more about that. And you can see this value is lower than what that Ohio value overall is. That's going down, arrow down, and it's green. So we want poverty to be lower. That is true. That is good. So that's why you see greens, and then you would see reds if this were higher, right? Then the last thing we didn't see before, these are comparisons to a distribution. So this one is to what I'm hovering over right now, all US counties we have data for. So we maintain data, especially from these national sources, across a ton of locales in our backend system so that you can see this in that bigger context. So it tells you in the little tooltip, this value of 8.3% for Dark County is in the best 50% of counties. So this can help you, especially when it's straight up like that and not positive it's supposed to be in the green or the yellow. This can clarify that for you. So we are indeed in the green. You made it just barely. Great work. And it tells you, so the green is top 50%, and then yellow is 50th to 75th percentile, and then the red would be the worst 25%. It tells you in that bold text what those value cutoffs would be as well. And then it also says how many US counties we're looking at for that full distribution. Same thing in Ohio County. Stark County, we're doing well comparatively for poverty level at least, so that's good to see. We might have a technical note or more details if there's a little bit more context you need. These are most often going to be specifically from the source, or like if any changes have been made, or a definition here, for instance, about what those confidence interval cutoffs are. So they're at 90% confidence intervals here. Then, like I said before, this link won't take you specifically to where these data live, but this more detailed section tells you which table you can find it in. And then the Help Center, this link will give you a little more context on this source overall if you want to go a little deeper. Okay, any questions here so far? This is the deepest dive, I would say. Okay, let's keep going. I won't take you too much in here, but I do want you to understand some of this, and then we'll take a hop back out of the data after this. So hold on tight while we're here. Let me know. Speak up if you have anything, if something's not making sense. Okay, so again, to my grant folks, these are all downloadable visualizations now as we're going. So we have a lot of historical data for this indicator specifically, as far back as 2007 to 2011. Some you won't have that much, but if you want to show kind of where we've been, where we're going, you can take this with you. So just those 3 little hamburger lines, the icon up top. In the right corner, we can download it as an image with a JPEG, as a PDF, or a CSV. So pop it in Excel if you want to put it alongside maybe your own data or something. Then also, if you're working with any health department folks or anyone who's interested in confidence intervals, you can select show confidence intervals. That's what I did. So now we see those here. That's how we determine statistical significance when seeing how they overlap. And then you'll see here, the default is to get a little bit closer on those data. So the y-axis, the vertical line here starts at 5, so we can see that change a little more in action. We can enable the zero-based y-axis though and see if you want to see it with the full context, and the line's just a little less dramatic, at least there. So those changes are doable from that top right corner. You can, if you download it with those already there, it'll keep them there in the download as well. Do you have a question? Sorry, I got excited. Maybe just someone breathing. Okay, and then we'll have next over here, you can see view by subgroup. So any subpopulation data that are available will be included down here. We have it selected. If we unselect it, it'll go away, but we want to see it. And this is by race and ethnicity. So you can see some different colors here. Here's our little guide as well. But we have all of the races and ethnicities that are available for these data. Some of these things can be interesting. So maybe like if there's not data, maybe there just weren't data available for that year, or maybe there aren't data in that county for a specific population. When we see these as gray though, you can see down below, it says no data on significance available. So often when we have breakouts, so these smaller subpopulations, we don't always have the confidence intervals to say that this data is statistically significant, different. Some of these do, so this is really just dependent on what the source gives us. Sometimes it's a little choppy. But from over here, we can see again, if we want to show those confidence intervals when we have them. So you'll see that these are blue rather than red and green, because if you look up and down, they all overlap with this overall value confidence, the overall values confidence interval. So just an idea of why these look like that, why they're blue, why they're not red and green, even though we'll see Hispanic Latino, this line goes out quite a bit more than the overall value. I would say from the data side, interpret accordingly, but also you can see what those values are and, use that in the way in which it makes sense alongside your community's narrative too there. And so the things I just told you, we do have this legend down here, but we can get a little bit deeper, just like in the dashboards overall. We can see the legend over here. It'll give you all of that information again, what red, green, blues mean, all of the different visuals here. And then you can click more if you want a little more. All right. So again, we have Dark County selected. As we continue on, these visualizations are also downloadable. This is highlighting the county that we have selected, but now you can see it on the map in context with the other counties we have available. And then if you see down below, these are grouped right now into 5 overall shades here. So from the lightest one being the for this specific indicator, so the lowest poverty rate here, to the darkest one being the higher poverty rates. So from better to worse related to these colorings here. And then we can see all of these on that bar chart as well. And these are downloadable from the top right corner. You can export that map. You can add the labels for what's what here. You can change that background map if you want a little bit less detail or more. That's the most one. And then, so if for some reason you don't want to see the comparison colors, you can turn the colors off on those. Same thing, top right corner, downloadable. You can show those confidence intervals if we have them. They're there. And then before we hop on from here, right now it's grouped, so it's comparing all of these counties to each other, but we could also compare them instead, say how are we doing compared to Ohio counties overall. So some of them might not have that. Looks like we only have them for Ohio, not for Indiana, because it's compared to Ohio counties. If we change it to Indiana counties, it's only Indiana, not Ohio, right? We could do a different comparison to something they all have, like US counties, they'll all show up.
You guys will have to look it up.
Then we have this data table with all of those values below as well.
Vitamin C.
And as we continue on, you can download that data table. And then at the very end, we have an overall, just a summary of what we've looked at. So there are 8 counties overall, 8 county values for this indicator. the range lowest to highest, and then the median value there, where we see that the half of the values fall within this specific range, and then the median at the end. And then data source, then again, how we saw in the dashboards topic, so it's economy, and then subtopic is poverty. And then this is, we have it classified as a social determinant of health as well. Last thing to see is all of this related content. So you are writing a grant and maybe it's not specifically focused on poverty, but you know that this gives a good background of what you're looking at, the kind of understanding of your community that you want to share. So we are looking at families right now, but also you want to take a peek at maybe children and seniors, so people 65 plus. So we have related indicators here. You can click more and see a lot more related to those. These are all specifically poverty, but you'll get a little more in that more button. But also, as we continue on, we can see promising practices here. So these are related to families. So Minnesota Family Investment Program. So families living in poverty. How have other communities addressed issues like this? How have they helped support families in poverty in different programs or initiatives we can see here? Then also resources, so stuff that's local to y'all. We've got the kids count. We've got some healthy start groups from for a historic look there. And then lastly, also funding opportunities. So this is really helpful. Say we're looking at something a little larger, maybe a few of y'all want to collaborate on like a Dell Foundation grant. You can see we have links to a lot of different funding opportunities nationally here as well. And then the chip, infographics, any other resources y'all have on the site that are classified similarly will also show up related to indicators. Okay, that was our deepest section, the deepest dive. We're going to take a step back out of the weeds now as we come, but do we have any questions? How are we feeling?
Just so you know, there's life on the call. I will unmute and speak. I think
You're fine.
I'm a huge data nerd, so I think this is super helpful. I love the promising practices on the bottom. I think, sometimes we get stuck in trying to figure out how can we address certain health indicators or issues in our communities, and knowing that that is right there at our fingertips where we can just click it and kind of read what others are doing. And if it was successful, I think is super helpful. So I think as organizations look at, if they're looking at expanding programming or, looking to address certain indicators or needs, I think that's a great resource for them. So thank you for pointing that out.
Absolutely. Thanks for that, Jess, too. Yeah, so like she said, if you get stuck, you're like, oh gosh, that's a lot. There are a lot of things going on here. If you scroll down, this can kind of guide you through. So say you want to get out of the data, you want to see a little bit more of what's going on in the world. These other related items can help give you that bigger picture to see kind of, and also in here, so it's family investment program, but maybe they also looked at like food access. So maybe it was something like specific of how they were choosing to invest in their local family. So it can help guide you through to what's worked elsewhere too. Yeah, great note. All right. Unmute if you need me, but let's keep it going. So this
You
is
have one
one.
question.
Ooh, yeah,
Sorry,
hey.
there's a question
No,
in the
please.
chat.
Fabulous. Yeah, hey Ty, thank you. So the update frequency varies depending on the source. I'll take it back up top where we can see, it was mentioned, but briefly, and there's been a lot of stuff, so you're fine. So up here we have the source listed and then the last update as well. This will be on any indicator detail page. So when you click on an indicator, get here. And for most sources, I would say state and national, they're usually updated around the same time each year. So we should look for this one again, February of next year. Some of those vary. Some are updated like on and off years, or some are updated more than once a year. So don't 100% stick to that, but that's the default for most, I would say. So annually is the brief answer. Thanks for the question. All right, then, so this is one indicator. Let's see how we can pull a few together. So if you remember, we were over here in Explore Data. We did the community dashboard. We looked at demographics. We looked at a specific indicator from those. We will take a peek at an index in just a second. But from here, under Create Reports, this is an indicator comparison report. That's what we have listed. So you want to see all of those poverty indicators together. This is how you could do that. If anybody wants to look at data other than those poverty indicators, speak now or forever hold your peace. Or you can feel free to pop it in the chat. We can also look at really anything in here, but this might be your most helpful tool to get specifically what you want here. So building a custom dashboard, we have all of these filtering options. So if again, we wanted to look at everything by a locale. So we were in Darke County earlier, but maybe we want to go to your hometown zip code, see what's going on there. We could start typing that in, pull up any of these, or just scroll through, get there. If we want to see all Darke County census tracts, this gives me that option and it'll populate them there. All zip codes. So this just gives you a quick selector on the side for some of those larger groupings. Get rid of those though. And then topics. So like I said earlier, we have those health, we have economy, we've got different things within there. We have education, you can see different things in there. So if you want to see all of the data related to one of these topics or subtopics, you can pop that in. Then as we get into some of these smaller filters, I would say just the rule of thumb, probably with any tool like this, is to start big and then narrow down. So start with a larger location or a few locations, and then maybe a topic, and then narrow it down. If you choose populations and a lot of things at once, you might not get many or any results sometimes, just because it gets narrows down what's really available there. But if you are specifically looking at any of these kinds of populations, so like just teens, older adults, you can select that and it'll give you any indicators that are tagged accordingly. Classifications, like we saw, the social determinants of health, that's where this would live, and pull up indicators classified accordingly. Comparisons, so like we saw, the comparisons to the overall state values, the US values, you'll see all those options in here. And then subgroups. So if you want to maybe add all data that has subgroups here, this includes gender, race, ethnicity, but also type of household for some indicators. Those and like DDI components are probably specific to like one or two indicators. That really is dependent on what's collected from the source. And then lastly, if you just want to know what's on the site by source, so we were just looking at an American Community Survey 5-year indicator. So it has that 5-year aggregate. That's why we saw like 2021 to 2020, well, 2020 to 2024 there, maybe 19 to 23. But we could get a little bit deeper and see what's specifically from Indiana. So we have DCS, Secretary of State. This is where you'll get some of those data points, the indicators that are a little bit more specific to where you're coming from. We could also look for Ohio, got a few more from there. Ohio, shout out to Ohio, you've got some good data sources and collaboration going on, so great work out there. But all right, I saw no call for other data specifics, so we're going to go to handpick indicators over here. And I'm going to choose my poverty ones. So if I start typing in poverty, I can see that this gives me just a little bit more than what's specifically under this subtopic. So we also see the adults with a disability, though they would show up related to poverty too. And then I'm going to keep everybody at 100% of the poverty level since this one's there. Let's look at children, families, people 65 plus, and maybe veterans in there. So I selected these specific indicators, and so we want to go to a different locale. Maybe we take it to a different county here. Or we could go to the service area. That'll give us a bigger picture one. And this is a roll-up of locales, so you can see the overall value for all of those counties. That's what we pulled together there. So I did 2 filters here. I'm going to stop there so I don't weed myself out of results. And here we go. So let's see. I've got 1, 2, 3, 4, 5. I think that's all I had actually. So we do have the data available for these indicators for that locale I selected. Great to see. And you can see it pulled it up just like before, organized here by topic and then subtopic if we have it. These will come in alphabetically, so that's why disabilities and then poverty, really health and then economy. And that is not alphabetical. Health comes first, always on the site. So side note. And then now I have a dashboard that I've made. So I know I wanted to look at these. I'm working for the overall service area. I want to see how these different populations compare. We have a really high rate for children living below poverty, but it looks like our veterans are doing a little bit better. And I can see that. So that's specifically for the counties grouped, but also related to the US values. I can see, oh yeah, we're definitely needing some help with children in poverty here. And so I want to keep this. I want to share this with my colleagues. We're going to start working on a grant related to this. So up here, I can save a link to this search. Copy that in, and I'm going to give it to y'all in the chat. There we go. So now you can go directly to that and see this exact thing, but also you have this whole option up top if you want to switch it up a little bit. So you want to see maybe if there are any subpopulation data. For these, there might be for a couple. I'm going to select all. You can search it, see what we have, and it'll show it in here. So we do actually have, that's nice to see the breakdown. So we're really seeing the highest poverty rates for the little babies. So that's a big difference there, 22.9% for kids under 6. Not a big differentiation between gender, race, ethnicity. We can see who it's most affecting there too. So like I said, this really narrows down the results. So we only have 2 indicators that actually have breakout data, so those subpopulations. So that's why I'm not seeing like my veterans or my folks 65 plus right now. But if I wanted to see them again, I could just delete these from the filters. Okay. Last thing here that we didn't look at earlier actually is the colorblind mode. We can turn this on. So if I can't distinguish quite as well between reds and greens, I know that's a common thing. We have these little thumbs that'll tell you. So red, the arrow is up. You can tell the arrows there, but the red, we're not sure of. So that thumb is down. Red is bad. Green is good. Thumb is up. And then these are you can actually export this whole thing as a card. So this card view up top, that little button next to colorblind mode. So now I see children living below poverty level with those breakouts, all that included, and I can save that card there. So it generates a JPEG, a quick image there for me. I think this will open up for us, hopefully. It gets a little overwhelmed if I'm on a call sometimes, so we'll see. But you can see all of that together, and this can be really helpful to pull into a report. So I kept the thumbs, still had them there. It looks like it didn't fully download well probably because I'm on the call, but normally this would show those bars as well. So, and it tells you the link to the site where it came from, the source of where that came from. So sorry, my computer's not too happy when I'm on a call, but yeah, so this is your custom dashboard. You have a link to this one that I just made. Any questions? Okay. Last data thing, and then we've got a couple of more fun resources, and I promise we will be on time. I know these things are just a lot quicker to look at. So over here under Explore Data, we have these 3 indices linked. The Health Equity Index, this will be changing to the Community Health Index with that upcoming product update. Just a change in name for folks that might be applying for federal grants that might not like the use of the words health equity. And then food insecurity index and mental health index, these are all maintained by our team. So we calculate these values. So specifically for the food insecurity index, we're looking at a measure of how folks are doing socioeconomically and related to household hardship and how that relates to food access. So here's the quick spiel: a measure of socioeconomic and household need or hardship correlated with poor food access. We do that with some specific validated indicators and calculate a specific index value from 0 to 100. So an index value, I'll show you down here, just hover over one. You can see that 2024 value is 80.6. But then also you can see at the coloring, I'll give you that legend down below, we have from lightest to darkest coloring here, showing that relative need. Right now, these are zip codes across all of your counties. So this is giving you that overall comparison. We could limit it to just the zip codes in Dark County, and you'll see the coloring will change because it's comparing all of these that are here. This probably makes sense to you of what is lighter and darker and why, but this can give you a little more context. This one I think is really interesting to see by census tract because we didn't have that darker point over here, but now we do. And this can really help you kind of pinpoint where we're seeing folks experience these specific things. So food insecurity, so like having lower access to food, but also mental health, and then overall well-being. That one's related to poor health outcomes, so preventable hospitalization and premature death, related to just several factors of like what makes life easier to be healthy. But if you want to get a little deeper, those are like very pulled back views of what these are measuring. And the how does it work little button, all of the pages have this. It gives you more specifics. So those validated indicators for this one are related to education, financial stability. This top spiel gives you a little bit more. But we also have that learn more. This takes you to our help center to give you that full context too. So this is downloadable, top right corner. You can add in what those census tract numbers are. And then we have the graph and table of the values all downloadable as well. These are updated annually. Each index, unfortunately, is updated at a different time annually, just in case you're like, well, this one's 2024, but the others are 2025. So it just depends on when we receive the data, and then we do the calculations thereafter. Okay, let's take the last couple stops on our tour. I'll go ahead and take you to this page, tell you how we got here. So promising practices, as promised, this is your navigation bar under resources. First thing here. Thanks, April. See that? You're totally fine. Go talk to your patient. No problem. Thanks for being here. Sorry. Please feel free to pop any questions in the chat too. Or if you got to hop, totally fine. We'll get in these last couple things. And I am popping the link to the promising practices here in the chat. I think I missed the last one, but it's on the site as well. So promising practices, as mentioned before, this is the overall tool here is a database, really presenting thousands. You can see over 2,400 promising practices, which we include programs, interventions, also policies. You might see a variety of things designed to help improve health around a variety of topic areas. So similar to the data we see on the site, these are the ways that we have seen folks put that data into practice. This is maintained by our team. It continues to grow. We have, I think, quarterly reviews of these that are here, but also adding new ones. All of the new ones that we're adding are primarily evidence-based practices. So we have rankings included. You can see filed under what that looks like. And that can range from an evidence-based practice with the strongest evaluation behind it, thinking of something like from a journal, a peer-reviewed journal, had numbers to show its impact. But then we also have some that are effective practices, which has descriptive observations that impact, but maybe not those hard numbers, the outcomes, maybe they didn't have the full evaluation there. And then also good ideas, so the last ranking here. And that may be a newer innovation, doesn't quite have full evaluation currently. You can submit any of your programs as promising practices, and we'll review it, whether it is put in the database for all sites or just on this one tagged as a local promising practice. We can definitely add it to the site. It takes at least about that quarter, just depending on when it's submitted, though. So I'd encourage y'all to poke around in here. You can search by any of these target audiences, some of those similar topics you'll see, the data, a lot of overlap in how we're classifying these things, so it's a little bit easier to understand and navigate. And they're alphabetical, as you can see, so if you just want to scroll through, get an idea, but I would encourage you to pull down by topic, maybe subtopic. And the last thing, we won't go too deep in here because we got one more stop, is our resource library. So resources, this is your overall resource library, but also the funding opportunities is housed within here. This is where we have a lot of those reports. So this is where your overall community impact report lives, but also the CHNA, the implementation plan. These reports, you'll be seeing some fresh versions of them soon. And the resource library overall, though, is really an unlimited repository for any kinds of local resources, whether those are these reports, like PDFs of things, but also it could be conference recordings, links to external sites that you found helpful for the community. All this stuff would be vetted by Jess and Katie, but you can see the kinds of things that we've added in the past. Anyone can submit a resource, and like I said, it would be vetted by their team. So submit here up top. And then we also have some collections with specifically for ACEs, and then the funding opportunities, that last place where you can see grants that we maintain. So these are mostly national grants that you'll see categorized by those different topics as well. Okay. While we did not get to, as you can see, everything on the drop-down menu, you should now more or less have an idea of how to understand what you see. So especially on some of these specific pages, you might see similar comparisons, different data visualizations. There are a lot of things that are also curated by Katie and Jess, so they can maybe give you more of an understanding if you have any questions related to specific priorities, like why and how we chose those. But I encourage you to poke around with what you have seen and heard today and let us know if you have questions, but hopefully this gives you a good baseline to better understand it. So I'm here if you have questions. I know we are now 2 minutes over, a little longer than promised, but thanks y'all so much for coming. And yes, a big deep dive. Thanks, Angie.
Yeah,
Thanks, y'all.
it's so good though. I think it's like kind of intimidating from an outsider looking in. Before I worked at Reid, I knew about the site, but I was kind of unsure how to use it and felt kind of silly asking, how do I use this site? So I feel like it'll just be such a good tool for everyone. So thank you all so much for your time today. I know with the weather, a lot of us have kids home and we're just functioning in chaos. So appreciate you all, and hopefully you can look further on the site and use it day to day.
Yes. Thanks so much, Jess and Katie, for putting this together, for setting this up. I hope this is helpful, and please let us know if you have questions. And we have the recording, so we will be putting that together and hopefully making it available.